Well, Chicago is going through a rebuilding period when it comes to the city's plan for mental health care. 6 years after Mayor Rahm Emanuel's decision to shut down half of the mental health clinics in Chicago, the city announced a new three-part initiative to bring back crucial services. Take a look.
What do we want? What do we want?
It was a sad day back in 2012 when the city of Chicago shut down 6 public mental health clinics.
Communities across Chicago have been feeling the effects ever since.
In 2011, we recognized that our clinics were on a path to failure, that we'd had a 90% reduction in our funding.
It has caused trauma and sickness amongst our community.
Mental health is an issue that also weighs heavy on Chicago's prison system.
I became aware immediately that we had this influx of people who are mentally ill. 40% of the people have a diagnosed mental illness that are in the jail.
We took the issue of mental health illness in the prison system and expanded on it. We talked to Sheriff Thomas Dart and the community to see what they're doing here at Cook County Jail to combat it. All the men and women who arrive at Cook County Jail get a mental health evaluation, but it comes at a cost.
The hard calculation of the cost for someone in my custody with a mental illness is in the area of about $400 or $500 a day.
Now that's all changing. Public Health Commissioner Dr. Julie Morita says the 2019 budget reflects the investments the city is making to fill any gaps.
We're building that bridge between the public and the community to the services that exist. We have over 250 clinics in the city of Chicago that are providing mental health services, and they're scattered throughout the city.
A three-part initiative starts by partnering with the National Alliance for Mental Illness, connecting their helpline to 311.
There are counselors on the line who can talk to individuals.
Allocating funds is one of the biggest challenges.
Of the 250 clinics in the city of Chicago, more than 60 of those clinics actually are federally qualified health centers that can provide these services to people who have no insurance.
Creating walk-in services is the next step.
There are some of those places already available, there just aren't enough.
Providing counselors to those who need it most is the final one.
So we're making that investment to be able to coordinate that kind of community level response, which I think is critical.
To help put this plan into action, the city needed to get some hard data.
I was waiting for data to say, well, listen, there's a thoughtful reason for these closures, and there was zero. There was none. Absolutely none whatsoever. It was just hard savings.
In the prison system, each person released with a mental illness is tracked here on this heat map.
You look at where the largest numbers are going to, least amount of services. This is so illogical.
Dr. Morita says the city didn't shut down the clinics just because, and the city did their part.
To make sure that nobody was lost in the shuffle or in the process.
Joel Johnson, president of HRDI Healthcare Center on the South Side, sees the impact the shutdown has had on our community. Still, he says there was nothing malicious about the closures.
We actually absorbed the patient population from a lot of the clinics that were closed by the city. It wasn't just overnight closure of a facility. That's not what happened. The city is more planned better than that.
The priority now is to educate the community on what's available.
The client come here and they get medicated, then they don't have the need or the desire or the urge for the street drug.
We want to provide services, we want to provide high quality, necessary, effective services.
Slowly but surely, the city, law enforcement, and healthcare centers are coming together for a solution.
And the silver lining is there has been somewhat of a great awakening here, that this is a train wreck.
The reality is that those 12 clinics were just a small part of the mental health system.
Well, to continue that conversation with us this morning is John Montgomery. And John, you have a BA in psychological and brain studies. And I want to start with mentioning that you worked at a clinic when it closed in 2012. So where do you think we are when it comes to mental services in the city?
Well, I think that's an interesting question. I think it's twofold as well. So on the positive, I do think that there's more awareness on mental health issues in the community nowadays. And I think that that makes mental health a priority now. And I think a reason for the 2012 clinic shutdowns is because mental health wasn't perceived as a priority before. In addition to that, I do think that mental health is now, more people are essentially going out and seeking treatment more than before. And I think the stigma around mental health is decreasing.
Right.
But on the negative, I do think that our communities are still in complete disarray. And I think the reason for that is because there's a lack of community-based mental health treatment.
And so when we're talking about treatments, we have the private and the public sector. Can you give us a little more explanation on what those are?
Yeah, so within the public sector, not-for-profit, I do think there are more opportunities for treatment within the communities, and treatment that is more so in your natural setting, which is essentially extremely important for treatment. But within the the private sector, I've gotten most of my experience through working in a psychiatric hospital. And to be completely honest with you, within that sector, I have seen that it's less about treating mental illness and more about maximizing profit. So within the private sector, a person's treatment is kind of decentered, and the center is now big pharma and insurance companies and maximizing profit.
So taking what you just said right now, we do have people in the private sector like Chance the Rapper who are making donations in hopes of making a difference. And I want to call this Sat here so you can take a listen.
I'm proud to announce that I'm pledging $1 million towards mental health services in Chicago.
So what do you make of that? What do you think about it?
I think it's incredible. I think it's a huge step in the right direction because there's so much work to be done within mental health. And I think it's beautiful when people who are in positions to contribute, to donate, and to actually make an influence do so and take the initiative. And I hope more people in positions of power take the initiative as well.
Well, John, thank you so much for your insight. Thank you so much for joining us this early in the morning. There's a lot of things that we definitely should look forward to, but the City of Chicago tells me parts of the initiative are already in place, but more languages and a wider range of hours of operation will be implemented. If you're seeking mental health wellness support, check out these centers spread out throughout the city. This list can be found on the Department of Public Health website.